Pregnancy and childbirth are often portrayed as magical, transformative experiences. But for many women, the reality is far more complex and far less supported. Welcome. I'm Tierra Duncan, and this channel is all about women's health, from hormones and nutrition to fitness and stress. Real science, real conversations, and tools to help you thrive. Today, I'm joined by Casey Keene, a postpartum advocate and author of The Alchemy of Motherhood, a forthcoming memoir examining birth trauma, postpartum mental health, and the failures of modern maternal care. Hi, Casey.
Hi, Karen. Great
Welcome to
being
the show. So, Casey, birth trauma isn't always obvious or dramatic, and many women aren't sure if what they experienced even counts. How do you understand birth trauma now? And how did your birth experience shape your postpartum period?
birth trauma, going through my experience in therapy and a lot of research I did for my book, birth trauma is not solely defined as a medical emergency or a dramatic outcome. It's how a woman perceives her experience. And if she is threatened, if her life is threatened, if her baby's life is threatened, if her autonomy is threatened, or if there's informed consent, is she seen? Is she heard? Are nurses and doctors taking the time to explain procedures? Is it a teaching hospital where doctors and students are just walking in and doing
Mm.
exams? So there's a lot of factors that play into birth trauma. And I think part of the problem is we hesitate to use the word trauma because we feel it needs to look a certain way. And what happened with my experience was it really laid the foundation for my postpartum. Postpartum is already challenging, as we know, but
Yes.
then we add birth trauma and mental health struggles, and it makes an already tough time even more challenging. And studies show that women who go through birth trauma are more susceptible to developing postpartum depression and postpartum anxiety in postpartum.
Yeah. So, what I'm hearing you say is that birth trauma doesn't necessarily have to look like this emergency situation or perilous, it can just be feeling unsafe or that your baby's unsafe or that you're just uncomfortable.
Yes.
A recommendation for an episiotomy that you aren't really comfortable with, or a
Mhm.
recommendation for a C-section. And maybe
Yes.
you wanted to try to labor a little longer, or, birth is scary. For
It is.
babies.
That's for
Exciting.
sure.
And, I know for me, I had this plan,
Oh,
and
yes.
naively, and then things never go that way. So you mentioned the postpartum anxiety and postpartum depression. How did that show up for you?
So they were very different. Postpartum anxiety was very loud and it came in the quiet moments, it came at night. It was hypervigilance, it was the inability to calm down, it was the constant checking of the monitor to make sure my son was breathing. If I heard a noise, I'm up right away. If I didn't hear a noise for too long, I was up wondering. So postpartum anxiety was very loud. Postpartum depression, on the other hand, was quiet, but it was an all consuming emotional flattening and detachment. And it was like a
Mm.
series of almost, like almost fine, almost happy. And they were both all consuming, but they were just very different.
Yeah, I can definitely, uh I definitely understand the postpartum anxiety, especially. I had wasn't an anxious person, and then right had the birth experience, and then I remember like waking up constantly, and I
Hmm.
had just chalked that up to just that's normal in postpartum.
Hmm.
That's just standard. Of course, you're going to wake up and worry about your baby, but for me, it was consuming all my sleep or lack thereof.
Yeah.
Right, we were already sleep
Yeah.
deprived. I
Yeah.
also, uh, found myself a lot angrier, like that
Oh, yeah.
that postpartum rage.
Postpartum rage is real. It is
Is
real.
that something that you think is, like, linked or looped in with postpartum depression, or do you
Yes.
think that that's kind of its own entity? Like, how do you view the rage aspect?
I think it's both. I
Mhm.
think if you suffer from postpartum depression, it's a lot. It's a lot harder. But I do think postpartum rage exists in both realms for sure.
Yeah, oh man.
I, I know it's tough. It's tough. There's not enough information given to women, right, with the hormonal changes, everything in postpartum, and it's really hard to navigate when you don't have all the resources and support that should be provided.
What do you think, speaking of, like, the resources and support, why is it what are the things that make it so hard to ask for help? Is it just, like, the recognition of the issue, those resources, like, kinda what are all the things that play into that?
100%. So I'm going to speak from my experience, and I think a lot of mothers could probably relate. I had no idea I was suffering from postpartum depression or postpartum anxiety, right? I had no idea. I think our cultural viewpoint too doesn't help, where we view a mother's distress in postpartum as normal, and it's not
Mm,
normal,
mhm.
and it shouldn't be normalized, right? But for me personally, I had no idea I was experiencing PPA or PPD up until I think it was like maybe over 6 months. My husband was like, "I think you need to talk to somebody." And I was like, "I think you're right." Uh, I thought it was postpartum. I thought it was motherhood because that's kind of what we're sold, right? It's hard. You don't
Mhm.
sleep. You're emotional. You're hormonal, but we're never actually given the correct amount or the correct information as to what truly is going on.
So where how do we fill those gaps then? Is, I know things have become a lot more information is out on social media, right?
Mhm.
But, like, where do we fill in those gaps, like, in the medical system when you have those appointments with your OB and you have the postpartum appointments, like, how do we
Yeah.
fill those gaps?
So it has to start with the providers, in my opinion.
Okay.
Mothers, like if I look back on my experience, I had no clue what I should look at, what I should be studying, what I should be researching. It has to start with the OBs. It has to start with the providers, where they give mothers this information during pregnancy, and also to draw up a postpartum plan, right? That's
Mm.
individualized based on a mother's current situation, where they have the support systems or the resources, or here's what to look out for. And then, of course, and I will always say this, there's no postpartum care, right? The first appointment is 6 weeks, and it's one appointment a woman has from a major physical ordeal. And that appointment is just a checking of the box, in my opinion. It is too far out to catch postpartum complications, and it is too soon to really acknowledge or give a nod to mental health struggles. My experience fits into both of those buckets in terms of my postpartum preeclampsia. I was readmitted 5 days after, and an in-home nurse even missed that. And
Oh,
then,
wow.
yeah, and then my postpartum depression was completely missed by the Edinburgh scale at my 6 week checkup. And my 6 week checkup was, "Hi, did you think about birth control?" And I'm like, that was
Girl.
literally, I know that was literally the entire conversation. So at the
Yeah.
time, and this was prior to everything, right? Like I didn't know how to advocate for myself. I didn't know what I should ask, like what labs I should look for, or requests for blood work, anything. And my entire appointment was, I press on your incision, looks good. What do
Ugh.
you want to do about birth control? That was, and it was
Yeah.
10, maybe 15 minutes tops. That was it. And that was my care. That was the beginning and end of postpartum care.
Yeah, it's so funny you mentioned that because I write about that in my book,
Yeah.
the birth control aspect where, um, yeah, it's just offered as a solution, but your body is just experienced, like you said, this huge physical,
Yeah.
emotional, and hormonal shift, this transformation, um, and the idea of just, like, medicating through it
Yeah.
is, Yeah, and
It's wild. It's
for some
wild.
women, maybe that is the right choice.
Yes.
But again, it comes with that informed consent. And
Yeah.
yeah, and I remember getting the questionnaire too, right? Like
Mhm.
going back to why I think we don't recognize birth trauma or why we don't recognize kind of the PPD or PPA is because I think when we see those questionnaires and it's like, do you want to harm yourself or harm your baby? You're like, no, of course not.
Of course you
Right.
don't.
And you will only recognize it if it's at that extreme, but it's like, are you
Mhm.
panicking all the time? Are you so angry you can't even think when your husband forgets to, or your partner, your spouse forgets to,
Mhm.
I don't know, clean the bottle? Or, do you feel despondent? Do you feel detached? Like
Yes.
those are things that you may not even acknowledge because there's levels to it, right? There's a
Oh,
range for emotions.
100%.
So your book is titled The Alchemy of Motherhood. What does alchemy mean in this context?
So there's a few themes in my book. So alchemy to me means change and transformation.
Mm,
So in my book, one of the themes is from pain to purpose and healing. So kind of like that transformation, as well as a transformation of a version of oneself to another. So from before motherhood to after motherhood, that transition. And then change also, or alchemy also, in context of my book, refers to the change in the current model of maternity care and hoping for change in that model.
For women that are resonating with this and have felt unseen, unheard, feel like they're walking around broken, what is it that you want them to know uh, through your experience and through your book?
So I want them to feel validated. So part of writing
Mm,
this book was validation. And if any woman feels unseen, unheard, or they feel that any part of their experience is unresolved, then it's significant and it matters. And seeking out that support, whatever that looks like, could be speaking to a friend, speaking to a therapist, joining a community. It's worth it. And you don't need permission and you don't need a diagnosis for that.
yeah, I think that's really a very important point to make, right? Like if you have any of those feelings, stop
Mhm.
dismissing them. You're
Yes.
allowed to feel those things. I had recently talked to we had a perinatal postpartum therapist on, and
Oh,
that was
yeah.
really kind of one of her points was that it, it doesn't matter where you are on that spectrum of feeling, you have to acknowledge it because guess
100%.
what? It's
Yeah.
not going to go away. And you have to
No,
work through it.
trauma lives in the body. That's what I learned, right, from my
Yeah.
experience. I operated for 2 years in fight or flight mode, and, I think a lot of women now research says that almost half, if not more, report that some part of their childbirth is traumatic. So you're talking, more than half of mothers now might have some form of birth trauma and or mothers 5 years ago who had no idea and now this is all coming to light. I agree, it's very important at any stage you need to getting help works, it matters.
I'm even thinking like our mothers and our grandmothers
Oh yeah,
and,
100%.
I think that those things can just sit, you know,
Yeah.
for decades in your body. When that's such a high number, right, for the birth to go back to the birth trauma aspect of
Mhm.
it. Do you think that that's, again, just a matter of, like, failed expectations or, not understanding the birth process or
Hmm.
the medical system, or maybe kind of just a mix of those attributes?
That's a great question. I think it's a mix, but I think that the larger percentage is the way that modern maternity care is designed. And I go into that into my book a little bit about switching from the midwife model into completely being institutionalized, where we lost
Mhm.
that generational wisdom and we lost a lot of the village, right? I mean, in all
Yeah.
honesty. And there's a price to pay for that. I am not anti science or medicine by any means. I'm just like, where can we find this happy medium? Because, I mean, the United States still has the highest maternity death rate, and it's still predicted to rise. So some things, as we're making advances, but we're not lowering that percentage, we have to take a step back and question what's going on.
Yeah, and I know for women of color, especially Black women,
Oh,
the
yes.
numbers are horrendous.
Yes.
And just like
They really are. They really are. I mean,
completely
it's horrible.
unacceptable. Yeah, so it sounds like uh, addressing the institutional side of it,
Mhm.
maybe, but also the cultural aspect of how we look at motherhood, how we look at pregnancy and postpartum care. Something that I've been thinking about lately a lot, being having a 2-year-old now, is postpartum really is forever.
It
You
is.
you I kind of went into it, even though I'm kind of very body savvy and know about hormones and all those things, going into pregnancy and going through that process and then having a baby, my expectations for myself were not realistic.
Oh, yeah. Mine
There's just,
either.
these, and I think a lot of it is cultural. So, along with the educational aspect, and I wonder how we get there.
Yes, it's all about information, right? It's about
Yeah.
advocating information. It really is. So it's very hard, obviously, to make a huge giant change where we're at with the institutions, but that's kind of why I wrote my book too, is I want to get it out there, right? I want expecting mothers, parents, whomever to read the book to say, wait a minute, how do we advocate better? You and I both know, and most mothers who went through childbirth, there's like a certain level where you can prepare yourself, right? But it's unpredictable. So is postpartum.
Unpredictable.
Yeah, it's completely out of our control. But I wish I knew everything now going into it, because I would have been a lot more prepared mentally and a lot more prepared emotionally. And that is the largest. So my experience, and I don't know if every woman experiences, but in the practice I went to, there was zero discussion, zero information about postpartum, zero. Not even a packet, not even like, here's some resources, no talks about it. And that's where we're failing mothers, right? That's where we're failing mothers. And they're looking to social media, which, sure, you could find some information, but there should be some form of central, agreed upon postpartum information packet that we can give to moms to prepare them.
Yeah. And I would say not even just moms, right? Like, partners need to be a part
Partners,
of that.
exactly.
Yeah, partners, families, whoever you have, uh, doulas, yeah,
Oh,
getting
so
somebody in
important.
there.
Yeah, doulas,
Um,
midwives, yeah.
yeah, getting everybody on board. If you were to kind of give women one thing to reframe about like motherhood or postpartum, what would that be?
Hmm. I would say that struggle is not failure, it's information.
Mm, that's
So
beautiful.
yeah, because I struggled, I internalized all of my struggles as failures. So every day I felt like a failure, right? And especially in the beginning of postpartum. So struggle's information. Struggle is telling you that something needs to change or that you need more support in an area. It's not failure, and it's not a reflection on how good of a mother you are. And I think that I know I defaulted immediately to, I'm terrible at this. This should be natural.
Oh, that whole, yeah, man, yeah,
Yeah.
you read the books,
Yep.
you think you know, and then you're like, "I have no idea what I'm doing. They're
Yep.
just passing me this child while I'm bleeding, while
Good
I'm
luck. See you later.
and I'm a mess, and all
Yeah.
right, I guess I'll suffer through this,"
Yeah.
versus, right, having that preparation. Yeah. Well, I really appreciate this conversation. I love how you've taken kind of your own experience and the things that you went through, and now you're seeking to
Thank you.
educate and empower other women. That's
Yes, I'm hoping.
that's
Thank
really,
you.
really amazing. And I
Thank
think
you.
if the main thing I would take away from our conversation today is that, um, hey, ladies, you have a right to be educated on something and be informed. You have a right to have a birth that
Yes.
doesn't leave you traumatized.
And you
And
can
that
say
you
no. You can say no. That's a
You
lot of
can
the
say
problem too.
no, and
Yes.
that you can feel supported in postpartum, uh, and to seek what you were going back to with, like, feeling those failures. If you're feeling those things, like, seek help, professional
Yes.
help, friends, don't ignore those are signals to your body's, like, waving the red flag. "We need
Yes.
help, we need help."
Yes.
Where can, women find you?
Oh, they can find me. So the postpartum advocacy site is the alchemy of motherhood.com. For my book, it's casey-keen.com. And on both of my websites, I have a link to my postpartum Discord for any mothers who want to join that. And it's a great community.
And where can we find you? Like, do you have other social media platforms? And when does your book come out?
Oh, my book will be published May 26th of this year. And yes, I'm on Instagram, Casey Keen Author. So you can find me Instagram and on the websites.
Awesome. Well, thank you so much for this conversation. What you're doing is really important.
Oh, thank
Um,
you.
check out Casey's book, comes out May 26th. Yeah.
Yes.
Okay, 2026. And then also make sure to check out Casey on Instagram, on her Discord, on her website, and we'll catch you guys in the next episode.